Hello, welcome to VNN. We have with us today one of the most dynamic mayors in the country, Bonnie Crombie of Mississauga. She's here, there, and everywhere, and always on the go. And tomorrow, Mayor Crombie will be joining in the Hazel McCallion 5 kilometer walk and run in Mississauga to fight type 2 diabetes. Welcome to VNN, Your Worship.
Thank you so much for having me. What a great afternoon.
Yeah, I know. It's nice and sunny outside. And tomorrow, I think the weather will be same when you go for the run, isn't it?
Yes, very exciting. So I'm really looking forward to this. I will be participating in the 5 kilometer Hazel Run Walk, which is part of the Mississauga Marathon. And this is the first time we're back in 2 years. So it's very exciting. This is normally the kind of event, weekend event that attracts 6,000 people. The full marathon and half marathon will start near Square One on Sunday. But the 5K and the 10K start on Saturday evening at 6 o'clock. So a little bit different. Yeah, and a lot of information available on the Mississauga Marathon website at mississaugamaarathon.org. So it's really important because we're trying to raise awareness of type 2 diabetes and what people can do to combat type 2 diabetes, which of course is be more active. So we're trying to show that with our activity, whether you walk or you run, any increased fitness will go a long way to helping you fight type 2 diabetes.
What got you into the diabetes fight? I mean, personally getting involved in this?
Well, I put a lot of emphasis on fitness myself. It really helped me during COVID, and I now go to the gym 3-4 times a week, and I feel healthier than I ever have, and I'm able to sleep at night and deal with the stress I have to deal with. But this is a very good question because I personally don't have diabetes, and no one in my family does. But because of our population and our demographics in Peel Region, in particular in Mississauga, but I know that Peel Region itself has 40% higher the number of type 2 diabetes cases than anywhere else in the province, which is very significant. We know that 1 in 6 adults 45 to 64, so an aging adult living in Peel Region will have this disease, which is very preventable, and 1 in 3 after 65. And we also know that the prevalence is higher among people who live in cities. 2 out of 3 people who have type 2 diabetes live in a city. And it affects people, of course, who live a sedentary lifestyle, who may be overweight. Those are very high risk factors. But then when you look at the demographic makeup of Peel Region, it's all the largest demographic groups, cultural, religious groups that are based here that are more so affected. So when you look at adults in Peel Region, Asian population, South Asian population, Arab, Black community as well, Hispanic and Indigenous. These are the groups, the ethnic groups that are increased risk of getting type 2 diabetes. So I thought it was so important because of our population and incidence of type 2 diabetes already in Peel Region, 40% higher than the Ontario average. It was so important to set a good example and be fit and participate in the marathon and encourage people to walk or to run or just stop using their car, take public transit, but get out and be active.
Yeah, I mean, I think I was just reading that the projected healthcare cost of diabetes in the Peel region is estimated to be about 700 million in 2024. And that's a lot of money to be drawn from the health budget, isn't it?
Almost $750 million when you think about it. So Mississauga signed on to the Urban Diabetes Declaration, and we joined the Cities Changing Diabetes. It's called the CCD program, Cities Changing Diabetes, and that was launched in 2014. And we are the only Canadian city that are active members of this. And that makes me very, very proud as well that we are the only city in Canada that has a strategy to combat type 2 diabetes and are participating in the city's Changing Diabetes Plan, having signed that Urban Diabetes Declaration last year. So I'm very, very proud of that here in my city.
No, I mean, I think the cities like Houston, Philadelphia, and Copenhagen, they're also part of this. Do you associate with them, or I mean, do you have contacts
Yes,
with
there
these
is
cities?
that opportunity because, of course, this is a very large and growing network of cities, but it comes with healthcare experts, policymakers, and community leaders who are all devoted to understanding more about the challenges of urban diabetes and working on solutions. And we do that together by benchmarking, sharing ideas, and sharing solutions of what has worked in each other's cities.
And, and and there is a diabetes prevention dream team that you have formed. I mean, when was this formed?
Yes, thank you for asking. I'm be on the 5K, as I mentioned, on Saturday night. Notwithstanding, I'm in the gym 3-4 times a week. I haven't done a lot of running, so I'm hoping the fact that I'm physically fit will help me. And I have the dream team. Yes, Dr. Lorraine Limscomb, who is the director of Nova Nordis Network for Healthy Populations at U of T. We have Dr. Ian Zenlia, who is the clinician, scientist, and lead at the Family and Child Health Initiative Institute for Better Health at Trillium Health Partners, our hospital network, and Dr. Laura Rosella, a renowned epidemiologist at the Dalai Lama School of Public Health at the University of Toronto. So this team is the team that is specifically focused on diabetes prevention, and we all take this very, very seriously.
So, I mean, you'll be forming a strategy and a sort of plan.
We'll be sharing ideas as we run, but this happens to be midges season, and we've got this little gnats floating around down here close to the lake. So I'll be wearing my mask, but for a whole other reason tomorrow night.
What are the program components of this of the strategy that you're forming? Any
Right, so we're in the, there's a lot more information that will be forthcoming. We are working on these strategies and we are sharing them, and there will be more information coming. There will be roundtable meetings, town hall meetings, etc. So this is just the start, but there will be much more going forward.
So is there another advisory board or apart from the dream team?
Not specifically, but it's been part of our this strategy, be part of the focus work that we're doing with the South Asian community and Black communities. So certainly there may be an opportunity with those groups. We've hosted a series of roundtable discussions with the South Asian community and the Black community. And the next steps will be larger community consultation on our type 2 diabetes strategy. And we'll talk about what we've learned from the other jurisdictions that are also part of the cities fighting urban diabetes. And these may be simple things like the fact that healthy food and beverage policies at our recreation facilities, eliminating soft drinks like pop and soda pop, implementing cycling master plans. We get more of our people out on our cycling paths and build more connected trails and cycling paths across our city, developing urban agriculture strategies to assist with the city's role in supporting corporate and community efforts to increase urban scale food production across Mississauga. So these are some of the kinds of things we'll be talking about in the community consultations going forward.
There'll be a lot of activities to gather and do, isn't it?
Absolutely.
What about the provincial government, the health ministry? Are they helping in any way?
So not in this specific case. Of course, they fund healthcare system. And so this is, what we can do in Mississauga and in Peel region to raise awareness of type 2 diabetes and the best methods there are for prevention, because this disease is very preventable. And if people are active and they eat well, then they too can prevent, type 2 diabetes in their lifetimes. So
the federal government has constituted a sort of committee. MP Sonia Sidhu, I think she's involved in the diabetes program.
She's very actively engaged on the file. I hope to work with MP Sonia Sidhu. She is one of the bright lights on this issue,
Yes.
one of the leading experts in Parliament. I believe she was a public health nurse focused on diabetes in her private life, in her non-political life, non-elected life. So I look forward to working closely with her. Of course, the federal government does have a strategy around diabetes as well.
I think these strategies should be taken all over Ontario, and first, if we start with the Peel region, Toronto, that's what is needed, isn't it? Are you pushing for that as well across Peel region?
Yes, absolutely. I hope that there will be more cities that will follow our lead and also join in with the Urban Diabetes Declaration. And they also should sign the Cities Changing Diabetes Program, CCD. I think, that'll go a long way. This is launched in 2014 by the Steno Diabetes Center in Copenhagen University College in London, and Novo Nordisk as well helps address type 2 diabetes through and obesity. They're very focused on this. And as we know, there is a program at University of Toronto that Dr. Lorraine Limscombe leads up that is sponsored by Novo Nordisk that is called Network for Healthy Populations.
Oh, that's very good. That's very good. Are you going to run or walk tomorrow?
Oh no, I intend to run, but I don't know. I'm not going to break any records. But I intend to, hopefully I'll, at a minimum, I'll walk, but I do intend to do a slow run, maybe a fast run at the end. I'll have trouble keeping up with those doctors. I think they probably very physically fit themselves. I'm the one who doesn't do the running, the practicing, but I do station training in the gym.
So did you buy new shoes, running shoes?
Oh, you know what? I didn't, but that's something to think about. I'll have some time tomorrow afternoon, maybe. Just like on budget day, you buy new shoes when you present the budget.
I didn't know that. That's interesting.
Yes. Yes, there was a lot of talk about our Minister of Finance, Chrystia Freeland, out shopping for new shoes for the budget. All the finance ministers buy new shoes when they present their budget.
So you're expecting about 5,000 to 6,000 people?
Well, 6,000 people will register for all the events. So that includes the full marathon, the half marathon, the 10 kilometer, the 5 kilometer, and there's also a 2 kilometer family run. So they can run, walk, rollerblade, etc. In the family walk.
Very interesting talk, your worship. I think all the best for tomorrow. And then would you
Thank
like
you
to tell
so
something
much.
something?
I'll let you know how I did.
We'll get our pictures.
Thanks very much for having me.
Thank you, your worship. Thank you.
Bye-bye.
Thanks for watching.